We welcome you all to Talk the Talk. My name is Janine Stiene,
And I'm Toni-Ann Antoniato.
the Masters of Myofunctional Therapy.
Together, we interview physicians, dentists, and other professionals to learn how their expertise can benefit you, your child, or your patient's speech and language skills and complement the services they are receiving. We welcome Kevin Simmons, also known as the Singing SLP, to this episode of Talk the Talk. Kevin Simmons is a speech language pathologist who has a passion for helping kids find their voice through the use of one powerful tool, music. Kevin's unique approach to speech therapy has helped children find their voice in an engaging and educational manner. Kevin's mission is to bring more awareness to the speech pathology field through song, educational videos, and a humor to better support those in need. Thank you, Kevin, for joining me this evening on Talk the Talk.
Thank you so much for having me.
Yes, absolutely. I follow your Instagram and you have some great content there.
Thank you.
And we wanted to just kind of have you on and have a little dialogue as speech language pathologists.
Yeah. Yeah, no, thank you for having me. And I hope the listener can learn a little bit about my realm, pediatrics, and just, yeah, educate people. And as I'm still learning as a therapist, so I'm very excited about this conversation.
Keep
Yeah.
learning every day in our field,
Yep.
right? Perfect. Well, most people have some type of story or some type of, where they started and where they are now. So whatever you're comfortable with sharing, we'd love to kind of know more about you and, where you have come from and what you're doing now.
Yeah. So my name is Kevin Simmons. I am known as the Singing SLP. I actually did not start my speech journey until later on in my life. So around 25, I had just graduated from Kennesaw State in Georgia, got my bachelor's in exercise science and psychology. And I was almost following my sister's footsteps in physical therapy. And it just kind of occurred to me that I wanted something different. I wanted to continue to um, use my passion with kids and listening to stories. And so I did one of those um, career aptitude tests, and speech therapy landed, within the top 10. And long story short, I started to shadow some SLPs, some occupational therapists, some PTs, and I loved every realm. But with speech, it seemed so natural, and it just seemed like it was something that was pulling me in. And so I remember after I shadowed this one speech therapist in Atlanta, I was like, this is the career for me. So um,
Wow.
I did a leveling program, which is just a program for the listener. It's a program where you're accepted into the grad school program. You just take the prerequisites. So it's another semester or 2 semesters to catch up, but you're already admitted into the program. So went to Radford University in Virginia and loved it, had great professors, learned a lot about who I wanted to be as a therapist. Loved the adult field, loved pediatrics, but they didn't really sway me. I knew I was going to be a pediatric therapist just from the get-go. So jump ahead to 2 years ago. I graduated from Radford and started practicing, and that's when I started to implement some of the things I learned. I'm all about visuals, I'm all about learning through experiences. So I wanted to tailor that um, into my own journey and to share with other people. So I started the Singing SLP page. It would just be some pictures, maybe some graphics, and I would sometimes do videos. And then it wasn't until maybe third or fourth month in my CF, um, I had a parent that was, asking for resources, just talking aloud about sensory haircuts. And I had been cutting my hair for all my life, it seems like. And I didn't have any experience on like cutting other kids' hair. I've cut my cousin's hair, but not like little kids, especially with sensory needs. So,
Yeah.
um, I told the parent, hey, if you want to try, like if you haven't found anyone, like let's just go ahead and try it. And from that day, I it was super encouraging. I saw, this child who had struggled with haircuts and it would take 2 hours to cut hair. And we got it down to 45 minutes. And so I
Wow.
know we'll talk more about that later on in our
Yeah.
conversations about sensory needs. But um, from that day, I was able to experience that as not just as a speech therapist or a sensory barber, but just as what we want to do. Like we want to move our kids and move our clients out the door so that they can be functional members of society. So I learned a lot from that experience, and um, I started to document my experiences with haircuts as well as with music integration. That's another passion of mine, and where I believe a lot of kids learn from music. I learned through music when I was in grad school. It helped me study, and I've created songs based, just, funny songs to help people remember the cranial nerves. And so, yeah, after a couple months after graduation, I just started the page and kept posting videos. And now it's, blown up to this thing where I'm meeting so many different speech therapists and occupational therapists, parents, and I'm learning with them too. So it's been I mean, very unique experience. So that's just a
Yeah.
little bit about me.
It's
Yeah.
so cool to kind of hear it from you. And, I see your content and it's always so engaging.
Thank
And
you.
was music always something that was like a part of you? Was that always something, even, when you were younger? Did you expect to pull music into your career, or did that just kind of happen?
That's a great question. It just happened. My grandfather, he was a musician. He was a professor of music. Um,
Wow.
I don't believe I got his singing voice. As you probably hear me right now, I'm congested, but I am not the best singer. I know I call myself the singing SLP, but I encourage people, even if you're not a Mariah Carey or Justin Bieber, just to sing because our kids like they love music, and it's I've pulled, hundreds of people that I've come in contact with, and it's just I don't think I've ever had someone say, no, I don't like music, I need silence. So it could be Beethoven's symphony, but I believe that
Yeah.
music is how I integrated it into my practice. I believe it creates so many possibilities when it comes to connecting with your client, working on articulation, even working on rhythm, working on a lot of my kids I serve are Gestalt language processors. They love music, and they learn through music how to break down language and communicate a Wheels on the Bus song to say Wheels on the Bus whenever they see a bus. So I always think that is so fascinating. And I need to do more research on music, but I mean I love it. Just the music brain and
Yeah.
how it adapts to a TBI patient and how it receives more information when music is involved, so on and so forth. But to answer your
Yeah.
question, I never really saw it as something that I would make it into my own practice. But now it's every session, at least every session, I try to incorporate music for my kids.
I love it. That's great. And especially with the pediatric population, we know how important building that trust and that rapport is.
For
So, do you
sure.
find that that's a big part of that? That we do have those children sometimes that are a little non-compliant or standoff or, just don't want to do the task at hand. So, do you find that using song and music can help build the rapport between you and your clients or patients?
Yeah, yeah, another good question. I think um and I've tried to create more videos on it, but I know that when it comes to SLPs in grad school or even 30-year SLPs, I found in my practice and found in repetition that connection it all starts with connection and how that piece um really builds rapport and builds a trust level because when we think about ourselves as individuals, I try to empathize and um facilitate all the things that I do and
Mhm.
do it to myself. Like with haircuts, like if I have clippers that are super loud, I need to test that out on myself. And it's like, ooh, that is a little annoying. So to answer
Mhm.
your question about music, I think it's
Mhm.
facilitated a lot of conversations, even trust level, like I talked about, which in hand, it makes speech therapy, it just makes therapy in general, occupational therapy, physical therapy, um, more of a connection and more of a bond rather than, oh, I'm going to speech. Ah, man, I have
Mhm.
to do this. Um,
Right.
but I've noticed that there's a motivation behind kids when they see that speech is going to be fun. It's going to incorporate their favorite Taylor Swift song, and we can make it funny. We can add twist to it, and so to yes, to your point, I believe that trust and connection is the hallmark to um, I mean later on success. So that it may not be 6 months of therapy. It could be 4 months of therapy just because um, people are trusting, us to dive into their world and dive into uh, personal, feeling of like, why am I going to this place? Why do I talk
Mhm.
different? Why are people looking at me? And just making
Mhm.
it an experience of like, hey, I'm with you. We all have our flaws. Let's connect. Let's use music to unify
Mhm.
us, and I think that goes a long way.
Yeah, I love that. And I think, like you said, the rapport, the trust, the fun. I mean, if we can have our kids have fun during speech therapy, we know that they're going to progress because we learn by having that fun.
For
And I
sure.
bet to your point of, you maybe not being the best singer, that probably is a good thing in a way because it's
Right.
almost like it's okay. Like, look at me, I can't sing, and here I am singing
Right.
and having all this fun. Kind of
Yeah.
takes away some insecurities of maybe like, well, I'm here for a reason, right? Sometimes our patients know, like I say things differently, or
Mhm.
I need more help than other children. And by you being so open with a singing voice that's not professional, it could actually, help those children with more confidence.
Right. Right. Agreed. Yeah.
Yeah, so I love that. You talked a little bit, so I'd love to jump right into the sensory barber
Yeah.
services that you do. So you told us how that kind of started and just happened, obviously, by seeing a patient or a client. How has that grown? So is that something that you are doing outside of your speech job?
Yeah. It's grown immensely, so much so. Um, I in the new year, I would love to have new hires for my business and kind of branch out and give them a lot of haircuts that I've unfortunately had to deny just because it's like they're it's sad because there's not a lot of resources. I'm in Georgia, so I couldn't imagine, across the country, um,
Yeah.
the need for haircuts, like for our autistic children, and what that means to be a safeguard, to be patient, and and I understand the structure too of just like running a barber business, and time is money for them. So
Yeah.
having 30 minutes of like, let's get it done, just hold them down.
Mhm.
That's their business and that's how they make money. But I've
Right.
strived to allow hour and a half. And that's super important to me, and that's those are my values. And so
Yeah.
unfortunately I've had to turn down just because um word gets out and it's like, oh man, I want, to see you. But I work Monday through Thursday as a speech therapist in North Georgia, and then Friday, Saturday I'll dedicate to haircuts.
Very
So
cool.
yes, it's grown so much that I've been able to do home haircuts. People will come to
Hmm.
the clinic. I've had reoccurring clients for 20 plus sessions. And it's almost like
Wow.
speech, like I'm able to see their growth and have a goal. Like the end goal is
Mhm.
for all speech therapists is to make them functional members of society.
Right.
So for, being in the barber realm, um, I have short-term goals of like Kevin Jr. will be able to um, tolerate, the sound of a clipper. We may not use the
Yeah.
clipper, we may use scissors, but that's a
Mhm.
huge win. And I think it's
Yeah.
expanded my mind. Um, not just in the barber realm, but in pediatric speech therapy to count the small wins. We sometimes have kids, I'm sure you've had children, in your practice for more than 6 months, and it's like, oh man, are we making any progress? So I've been able to look at it's always a journey. There's no like steep influx of like, all right, we're on the right track. Um, because there are going to be bad days. There's going to be days that we as humans, I don't have the best days. So just like I'm
Mhm.
reminding parents, I'm reminding myself that in the barber realm and speech therapy, that even though that there's waves, there's valleys, we're heading towards the right direction. And so like I celebrate those small wins for our kids that even come into an environment where they don't know who I am. Yes, they
Mhm.
may be crying, they may be frustrated, but they met someone that is about to cut their hair. Um and that's a huge win. Like if we look at it and look at the grand scheme, that's huge because like as a kid, just even as myself, like going into a store that I don't know, I'm sure it's overwhelming and it's like, whoa, where am I? What is this? Who is that? So counting the
Yeah.
small wins, I've noticed. And again, this is for the listener out there that maybe is a little frustrated with the progress, or if they don't feel there's progress. But if we look back on, the inception of where therapy started and like where your kids are at now, um, maybe it's a new sound. Like a child may be making a clicking sound, and they weren't doing that 6 months ago. As small
Mhm.
as that may be in the moment, if we look big picture, that sound wasn't there 6 months ago. So just counting the small wins can help encourage
Yeah.
the parent, the caregiver out there, and even the speech therapist.
Right,
Yeah.
right. Especially the newer clinicians, we take on at our practice, we're a private practice setting, which I'd love to hear where exactly you are too. Um,
Mhm.
we're a private practice, so, families come to us. We're not pushing into their homes, we're center based. And
Mhm.
with newer clinicians, we take on clinical fellows. And
Right.
sometimes that's one of the biggest things we have to help them recognize that you might not have gotten to that long-term goal just yet, but hey, we do feeding therapy quite often within our
Yeah.
practice, and They might not be eating that food, but they're tolerating it on the table. Like that is
Yeah,
a win. Like that is
yeah,
progress, small steps sometimes. And I think that's some of the hardest things for the newer clinicians because they're like, all right, I'm ready to go. I'm ready to change the world. I'm ready to help all these patients. And then they're like,
yeah.
wait. And I'm like, no, these are wins. This is good. Like we're moving in the right direction. We have to move at the patient or the child or the adult's pace, and not, we have to meet them where they are.
Exactly. Yes, very much so.
So what are you in a private setting type of practice, or are you in the schools? What setting are you in Georgia?
So the Monday through Thursday job I'm in is a private
Yeah.
practice. And then
Okay.
um like I said, Friday, Saturday, I have
Mhm.
two virtual clients I see on Friday um under my own practice, but the rest is haircuts. So it's yeah, it's a balance of like expanding and understanding my growth, but also
Mhm.
recognizing it's hard to like just go off and start to do your own thing because you leave a
Yeah.
lot of families and um, a
Yeah.
lot of families that have become family. So
Yeah.
I know right now I'm very comfortable where I'm at, but I know that yes, there's just as many kids who need speech. There's so many kids that need haircuts. So
Yeah.
it's and two for the listener, for the speech therapist, also setting up good boundaries. I know that I'm sure you could speak on it as well. Having boundaries of like um this is where I'm at. Like I know early on in my CF, I would just take on so much. And I wasn't doing justice for my families because they were getting the 80% Kevin who was like flustered doing this, trying to do that, accepting every role. And and at times it would be like, man, is this Kevin like is he like here? Is he present? So just reminding it's okay to like, yeah, of course, I know some people work, Monday through Sunday. But just also reminding yourself that it's a no doesn't mean um you don't love or care for someone. And I've learned that just, as a personal testimony, I've learned that, in my career that a no isn't saying no to like forever or I don't like you. It's just setting up a this is where I can succeed for you later on and be a better individual. And then as a speech therapist, like providing resources. I think I was talking to my colleague about it, but for the listener out there, for the speech therapist who needs to know that like it's okay you to not know all the answers.
Yeah.
And it honestly it shows a lot of maturity to say, I'm so sorry. I don't know much about that. Let me do some research as your speech therapist. Let me get with some colleagues and I can get you that answer in a couple days versus like, oh
Mhm.
yeah, that's that's the route you want to
Yeah.
go and it's we don't know anything about that. So
Right.
um
Mhm.
so yes, boundaries and then also
Mhm.
just being okay with saying you don't know. Because I promise you,
Yeah.
there are so many speech therapists. I mean, I for one, I continue to tell people I don't know any or a lot. That's why I keep saying in my videos, let's continue to learn together. That's it. That's I
Yeah.
mean, that's therapy, that's life. We're all learning.
Yeah, 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 absolutely. Someone that I was listening to speaking at a conference had said, like, the day you, as a speech pathologist, the day you stop learning is the day you
Mm,
need to retire because our
yeah,
field is
yeah,
just always evolving. And,
that's good.
we have that conversation again because we take on clinical fellows. That's literally exactly what we say to them. It's okay to not know. First of
Yeah,
all, we're in a field field that is, our scope is so huge, right? And at a private practice, a lot of the times we're seeing a big diversity in our caseload in terms of what we're treating. So as a
Yeah.
new clinician, especially, you're not supposed to know everything. You maybe never saw this type of voice patient, or you maybe never had an adult with this, type of aphasia. And it's okay to be like,
Right.
hey, that's a really good question, and I want to really make sure I can answer that to the
Yeah.
answer that you deserve. So let me go to my supervisor. Let me talk to my colleagues. Let me do a little research and let me get back to you with the best answer. And yeah,
Yeah.
that takes a little bit of a confidence to feel comfortable to say that.
Yeah, for sure.
It's important. So if I've gotten your timeline a little by what you've said so far, you are relatively fresh into this field. How many years into speech therapy career are you?
Um, I I told you 2 years ago, I started the singing SLP. I just realized
Yeah.
I had my 2 year work anniversary at my current
Okay.
job. Um, and
Okay.
then I had my CF, so it's actually been 3 years I've been practicing. I know
3 years,
time
which
flies. It's
feels like a long
yeah.
time, but in the grand scope of things, right? You're kind of just at that starting of career
Yeah,
when you think of the long, big picture.
for sure.
Somebody who's not that far at a grad school, not that far to your clinical fellow. So what is some advice you would give to those currently in it, if going through grad school, or if one of our clinical fellows are listening to this episode, what's some advice that you would give them?
Yeah, I think when it comes to I'll speak to the grad student first.
Okay.
With grad school, um, like I talked about with boundaries, setting yourself up for success and creating a time management program, even as simple as um, providing like in your calendar a reminder, hey, study break. Because I remember I'm not kidding, I used to study so much. I would, I never went out. I never, like, I would just stay in my dorm room and study. Um, and,
Wow.
I think for the grad student, I want to say that um, it's great that you are obtaining all this information. Um, but remind yourself that this information is going to build on one another. I think I would get so stuck on the fact of, oh man, I made a 95. Like, I missed this answer. Like, I'm gonna make sure I memorize it. Um, I don't think I look back now and I know I don't think I know that the parent that I'm talking to about apraxia like doesn't want to have a memorized answer of, oh yes, if I can remember, childhood apraxia speech has this. um I want to speak on experience. I want to speak on some of the mistakes I've made. And mistakes can sometimes have a bad connotation. But if you look at um, the mistakes, during a test um, or even like with the verbal exam, and you recognize that, like, okay, I did not have the right answer there. My teacher was able to
Mhm.
provide me this answer and how it builds on one another. I think you'll have more of a learning opportunity versus, oh, I made a 100 and now I can just move on to the next test, which I used to do. I would move on to the next test and
Right.
um, and start memorizing for other chapters, not recognizing that, lo and behold, everything I'm talking, and you've expressed it as well, everything in speech therapy builds on one another. I'm talking everything from the cranial nerves. We can talk
Mhm.
about the cranial nerves, and how that affects, if cranial nerve, let's see, I don't want to mess this up. Like one, which is the abducens, I think. Oh no,
Okay.
no, I'm sorry. Oh, optic. Um,
Okay.
is the optic nerve. So like that deals with the eye. Um, and like how that affects the left side of the brain, right side of the brain. Ev- my point is that everything builds on one another. So, for the grad student, just reminding yourself that don't pressure yourself to make straight A's or, um, if you miss something on a test, uh, learn from that, and then uh, also talk to people about it. Talk to your family. Explain what semantics means. Because I've noticed when I'm able to explain something to a parent, um, that also will help you get ready. And I'm speaking to the CF now as well. That will help you get ready for parent coaching. Because I used to do this all the time. I would say all these fancy words, and I remember a parent was like, "Kevin, I have no idea what you're saying." So it's a humble reminder that
Sounds really smart, but I don't know what you're talking
right,
about.
right. Um, it's a humble reminder that as the CF and as the grad student is preparing for an exam or even for parent coaching, you have all this information now. Now explain it, and this is your learning opportunity as well. Explain it in a way that is going to we talk about the three pillars of a holistic approach. We talk about research, the client, and your clinical experience or expertise. So if you're able to communicate things in a way of like, all right, my best interest is in what you need to communicate. So you have apraxia, you want to be able to talk to this McDonald's employee to order a burger. Let me research and let me also give you my expertise, but say it in a way that is going to bring those three pillars together. Um, so I said a lot right there, but for the CF, like just reminding yourself for parent coaching to use simplistic terms. They appreciate that. They have a lot more understanding of apraxia. They have a lot more understanding versus going to Google. I'm sure we've had a ton of families. I do it when before I go to the doctor. I'm like, all right, let me Google this. But you went to school for 2+ years, so it goes back to our response of like, one, it's okay to say you don't have the answer, but two, remind yourself that you went to school for 2+ years. The imposter syndrome, I know that it's gonna weigh heavy, but um, you're you're not on your own. Whenever people say, "All right, you're on your own in the CF," like you have your supervisor, but do your thing. There are so many resources available. There's so many mentors, supervisors that you can call on, and that would be my other piece of advice: is ask questions.
Mhm.
It is not
Yeah.
um, frowned upon for you to ask questions about where, you keep the oral motor programs in the clinic that you've never been to. Uh, but I think we sometimes get into this mindset of like we have to know everything. But it's okay to not, you know.
Yeah,
Um,
yeah. I think that's important. I love what you said about making those mistakes and even from grad school, but applying that to your clinical fellowship. Like you learned by trying to use huge speech vocabulary, right? That was that you learned from that and
yeah,
realized, okay, that's not how I should talk to parents. I'm going to talk more in a way that they can understand,
right.
but yet I'm still educated. I still know what I'm talking about. I don't have
Yeah.
to fancy up what I'm saying with those technical terms. And I think there's a lot of that should happen during your clinical fellowship where
Mm,
you learn from your experiences,
yeah.
recognizing, especially a lot of newer therapists are not don't have their own children, or maybe they don't have nieces or nephews that are young. And, going through that type of experience can change things for you. Like, wow, like this, I see how much love I have for my niece or my nephew or my own child. And this is somebody else's child, somebody
Right.
else's niece. And,
That's a good point.
those things start to happen when you're in the real world and you realize, like, I'm talking about the most important person in this person's life. And, I got to talk to them in a way that they will empower them to support this child.
That's a very good point. Yeah. No, I love the way you said that. Yeah, that's someone's important
That's
person.
yeah,
Very good.
right,
Yeah.
right. Yeah. Yeah, absolutely. It's just a special time, your clinical fellowship. We love taking CFs because it is, it's the start of their career, and it's
Yeah.
just a special time for them, and really will help lay their foundation for a career that can blossom. And I don't know, did you think during your grad school or clinical fellowship that you would be where you are today with your, Instagram account and your sensory barbershop? Were those all things that you wouldn't have pictured 5 years from now, before now?
Um, that's a good question. I don't think I would have imagined it. I know we have such a great community. Um, I mean, truly, like from the start of grad school, I had, and still lifelong professors that, have become family mentors to me. So like from grad school to even coworkers and colleagues, like I've worked in good environments that are going to lift you up, and um, it seems daunting entering the real world, but for the grad student and CF, like people, this is like grad school. Like they want to have you graduate. This is, I mean, to put it point blank, this is their place of business. They want to see you succeed. Um,
Mhm.
to, have more kids come in, and provide therapy. So you have a lot of support. And I've had a lot of support. I didn't think that it would get to a point of like, um, one of my good friends was able to, uh, I worked for her. She was able to create a barber suite, um, in one of the rooms. And so like it's definitely been the hospitality of our community that we have, and the connections I made through the internet, um, giving me advice on, hey, you should do this for content. You should do this for haircuts. So it's always a learning experience. It's always like picking up information, um, and like I mean, truly taking from that. And I think it's been a blessing to see on social media. There's been some accounts and videos I followed, and I'm like, oh my goodness, I gotta try that oral motor technique. Like I've never done that. And like to
Uh-huh.
try that on one of my kids and have success.
Mhm.
Sometimes you will have success, sometimes you won't. But just to like have that community is super important. And another piece of advice I'd tell is, for the grad student and the CF, is to have mentors. Like, I think, I look forward to the time of taking on a student. We have so many people in this field that want to educate and help the next generation. So, having a mentor, having someone to talk to, and just ask questions and, hey, I want to start a business. Like, I didn't know anything about starting a business. I truly found people in the SLP community and they gave me advice. So, leaning on those resources, they're out there, and taking use of that. So, um, yeah, I mean, I never imagined that I would get to this point. So I'm excited to see what happens next.
Yeah, I'm excited to keep following you and see where your journey goes, because
Thank you.
I think there's many things up ahead for you, which is brings us to a nice closing question for you. What do you feel is something you hope for this field of speech pathology to, continue to evolve? What's something you're passionate about that you hope for this very rewarding and amazing career of ours?
Ooh, um, so good. I think uh I created this page based on, like, honestly, I think I have it in my headline. But to create joy, and educate, and just to have fun, and humor.
Yeah.
So I think
Mhm.
I'd love for this speech field to, um one, I want to have more resources for gestalt language processing. Super passionate about that. I think that is, we don't have a ton of research on it, but I would love, um in the next 10 years for us to have more solid research, and be able to communicate to parents on, like, hey, this is something I see, because I do believe it's growing. Um, so
Mhm.
that's been on my page. Sensory. Um, I would love for this field. We have a lot of therapists out there that have sensory programs, Jesse Ginsburg, but I would love to have a lot more sensory, even in grad schools, like, um, sensory classes, because I mean, I've seen it. You've probably seen it firsthand. Once sensory needs are met, communication and output is going to expand. uh, I mean, that's another conversation we can talk about, but
Yeah,
yeah,
that's
I
a
love
good one
that
too.
aspect of, like, fulfilling sense, and then language and speech, can
Yeah.
be met.
Mhm.
And then behavior, just, I have a lot of kids that kind of tie in with sensory, but um,
Yeah.
how can we best support our kids that have high behaviors or sensory needs, and just encouraging them through that. So I think it all goes back to answer your question, kind of in the grad realm, and how we can provide a lot more resources for these topics that I wouldn't say are, like, um, new or evolving, but just something that I know I've experienced as a clinician, and heading into therapy, in my CF, like, I would have loved to have more resources on gestalt language processing, because I'm
Yeah.
providing a child, and I did it for however long, with traditional methods of, like, no, sit down. I know you're frustrated, but you got to sit down. Not knowing,
Mhm.
that it, yeah, it wasn't really benefiting them. So,
Mhm.
yeah, those three things I would love to see.
Yeah,
Yeah,
that's great. I think there's high hopes for all of that, and
I
people
agree.
like you continuing to advocate for the field, and continuing to advocate for the fun and spreading the joy and love and making that connection. That
Thank
is the foundation to be able to really support our patients. And I love that you highlight that and you
you.
have this huge audience that you share that with. So we appreciate you and all that you're doing for our field.
I appreciate you. Thank you.
Thank you so much, Kevin, for coming on here. It was so fun to just kind of hear from you and pick your brain a little bit and hear all the fun things that you have going on there. I hope that our paths can continue to cross, and I look forward to continuing to follow you on social media and see all the fun that you're up to. Thank you for joining us on this episode of Talk the Talk.
We hope it was enjoyable and educational and further supports you both personally and professionally.
For more information, please check out our Wyo Mayo and Mayo Minute podcast, as well as our other episodes of Talk the Talk. And don't forget to check out our tongue training appliance, Spot Pal, to help with tongue thrusting, thumb sucking, snoring, TMJ, mouth breathing, and so much more. Visit thespotpal.com.